Do you know how gum disease treatment can influence cardiovascular disease? Hi, here's Dr. R. Today we're going to talk about this masterpiece of an article dating gum disease to cardiovascular disease. It's a consensus report done from the American Academy of Periodontology and the European Federation of Periodontology. So this report mentioned multiple studies that report increase on toothbrushing, dental visits, dental cleanings like prophylaxis, and periodontal treatment. They will be related to a reduction on acute cardiovascular disease such as heart attack, stroke, and others. One of the studies was quite interesting. Reported on about 12,000 patients based on hospital admissions. Finding no difference of brushing once a day or twice a day make a significant difference on acute cardiovascular disease. Ones that brush only once a day had the highest incidence of acute cardiovascular disease. Another very interesting study that they mentioned is that this study evaluated about 9,000 patients from 1979 to 2012. It shows that the patients that showed an increased vascular disease rate were the poor responders to periodontal treatment. So they concluded that periodontal treatment, when it's done successfully, when the patient has a proper follow-up, they show a reduction on the incidence of acute cardiovascular disease. Another very interesting report on the study is that they gathered multiple studies. They evaluated the influence of periodontal treatment on multiple markers of cardiovascular disease. They showed that the patients that had a successful periodontal treatment, they show an improvement on controlling the blood pressure, on the endothelial function, that means the blood will flow better, on systemic markers like interleukin-6 and C-reactive protein, they both showed a reduction on these systemic markers, and also on the function of the carotid. The blood will flow better through the carotid. All that related to a successful periodontal treatment. Another thing that the study mentioned is the use of statins to reduce the cholesterol. There were some reports that correlated the use of statins to better dental condition, influencing on gingival inflammation and bone loss. They show limited evidence, but it's very interesting to see that there was some sort of correlation. So again, putting all this data together, there's multiple sources of information that show a correlation between gum disease and cardiovascular disease. As I always say to my patients, healthy mouth, healthy body.